Dr. Paul Robinson. I'm an emergency doc and a pediatrician. I live here in Tarpon Springs. And I'm a Coppola Fellow with the National Physicians Alliance. We are an organization of about 10,000 doctors, multi-specialty, nonprofit, and our principal reason for existing is to advocate for patients.
And so you're supporting the Affordable Care Act. How is that advocating for patients? How do you think that benefits patients?
You know, I've seen many times, many patients, Sean, whose lives improved after they obtained health insurance under the Affordable Care Act, under Obamacare. Prior to the passage of the act, because we see people regardless of whether they have insurance or not, I saw many people who did not get the diagnostic tests they needed and didn't get the care that they needed because they couldn't afford it.
Max, what do you think?
After Obamacare, after the ACA passed, those same patients obtained health insurance. They got the diagnostic tests that they needed, and they got the medicines they needed and the other care they needed. I saw their health improve, of course, but I also saw their families' security, and that was one of the great benefits of that act.
And if today the AHCA, the American Health Care Act, passes and Obamacare is repealed and replaced with this act, how would people's outcomes change?
If the AHCA, what is called American Health Care Act, passes, it'll be a disaster for patients. 24 million people across the country will lose their health insurance over a 10-year period. 14 million are projected by the CBO to lose their health insurance in the first year. Insurance policies will increase by 15 to 20%. People will simply stop taking insurance. But it's not just that, because the AHCA, as it's written, doesn't just repeal and replace. It also cuts and caps Medicaid to the tune of about $900 billion. I think the actual number is $880 billion. Let's talk about children. In Florida today, 2.6 million children are covered under Medicaid and our version of CHIP, which is called Florida Kid Care. The marketplace under Obamacare added another 122,000 covered children. So between 2.7 and 2.8 million children are covered. It's been shown many times that a child who is covered under Medicaid, I'm talking about Medicaid, misses fewer days of school, does better in school, more likely to graduate from high school and attend college, makes higher wages as an adult, is healthier as an adult, and pays more taxes. This awful non-health, non-care act that's being voted on today would gut the Medicaid system. And states would be losing millions of dollars in what is now guaranteed federal money and would no longer be. It's unavoidable that states would either have to raise taxes, cut payments to providers, or more likely ration care. And some of that ration care would mean our kids would lose their insurance.
Finally, who's your member of Congress, and do you have a message for him or her about the vote today?
Yes, I do. My member of Congress is Gus Bilirakis. He's a very nice man, but he has told me he intends to vote for this awful act, what I call the awful, half-baked corporate welfare act, because the point of this act is to give a tax break to the wealthiest Americans and provide corporate welfare. That's the rationale. It's not about care. It's about a tax break for people who don't need money. And the result will be fewer kids and fewer working families that are covered. So I urge Congressman Bilirakis to vote against the AHCA.
Thanks for your time.
Thank you.